Hello, everyone. It's your boy Ovi Mark, and you're welcome to Artified Optimist. So there is everyone knows around the world that coronavirus, codenamed COVID-19, is currently on a rampage all over the world. Started from China and it has spread to various parts of the world. Now we were thinking that the sickness or the ailment will not find its way to Africa. But as we speak right now, it has found its way into Africa. A case has been reported in Algeria, and just this morning, today, Friday 28th of February 2020, a case has been confirmed positive in Nigeria. So it was an Italian man who came to Nigeria en route Turkish Airlines all the way from Italy. And reports have it that he works here. He works with a company in Ogun State. Now, reports have it that the man flew into the country on Monday, but he didn't show any signs of the ailment. So on Wednesday, he developed symptoms, and then on Thursday, he was rushed down to the hospital, Yaba Specialist Hospital here in Lagos State. And ever since then, he has been quarantined. Now, a lot of people have expressed fears over this, but the Lagos State government has assured that the case has not gotten to a level where it can be transferred from person to person. So the health commissioner of the state and also the state governor, Dr. Sawonlu, they have allayed fear to the public that people can go about their normal business, that the man who was involved in the case has been quarantined and he's being supervised and watched closely. And the good news is the man is responding to, or in other words, is cooperating with the government and is not being stubborn. Okay, so the government, they seem to be, according to them, they seem to be on top of the situation. No need for this, the citizens to panic at the moment. Also, this evening, it was confirmed that about 28 persons have been quarantined in Ogun State. So the government is trying to trace back everyone who had contact with this Italian man. You know, the hotel where he slept, his employers, and where he works. Everyone is being traced back to see if anyone has contacted the virus. So far, 28 persons have been quarantined, you know, to get out the man, making them 29 or so. But the government is working closely on this issue. Now, okay, so now that we've confirmed a case of coronavirus in Nigeria and several persons who had contact with the victim have been quarantined, here are some simple tricks that we can do to keep ourselves protected, that you can do to keep yourself protected. Number one, and these measures are recommended by the World Health Organization. Okay, so wash your hands regularly. Why do you have to do this? Washing your hands with soap and water or using alcohol-based hand rubs kills viruses that may be on your hands. The next is maintain social distancing. Maintain at least 1 meter, that is 3 feet distance between yourself and anyone who is coughing or sneezing. Why? When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. If you're too close, you can breathe in the droplets, including a COVID-19 virus, if the person coughing has the disease. Next, avoid touching eyes, nose, and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the disease to your eyes, nose, or mouth. From there, the virus can enter your body and can make you sick. The next one, practice respiratory hygiene. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Why? Droplets spread the virus. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. If you have fever, cough, and difficulty breathing, seek medical care early. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention and call in advance. Follow the directions of your local health authority. Why? National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your health care provider to quickly direct you to the right health facility. This will also protect you and help prevent the spread of viruses and other infections. Next, stay informed and follow the advice given by your healthcare practitioner. In addition to the protective measure, the World Health Organization has addressed some myths about the disease. Here they are, as written by the UN agency. Are hand dryers effective in killing the new coronavirus? No. Hand dryers are not effective in killing the 2019 coronavirus. To protect yourself against the new virus, you should frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are cleaned, you should dry them thoroughly by using paper towels or a warm air dryer. So the next myth: can an ultraviolet disinfection lamp kill the new coronavirus? UV lamps should not be used to sterilize hands or other areas of skin, as UV radiation can cause skin irritation. Next, how effective are thermal scanners in detecting people infected with the new virus? The thermal scanners are effective in detecting people who have developed a fever, that is, have a higher than normal body temperature because of infection with the new coronavirus. However, they cannot detect people who are infected but are not yet sick with fever. This is because it takes between 2 and 10 days before people who are infected become sick and develop a fever. Next myth: can spraying alcohol or chlorine all over your body kill the new coronavirus? No. Spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. Spraying such substances can be harmful to clothes or mucous membranes, that is, eyes and mouth. Be aware that both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendation. Next myth: is it safe to receive a letter or a package from China? Yes, it is safe. People receiving packages from China are not at risk of contracting the new coronavirus. From previous analysis, we know coronaviruses do not survive long on objects such as letters or packages. Next myth: can pets at home spread the new coronavirus? At present, there is no evidence that companion animals/pets, such as dogs or cats, can be infected with the new coronavirus. However, it is always a good idea to wash your hands with soap and water after contact with pets. This protects you against various common bacteria such as E. coli and Salmonella that can pass between pets and humans. Do vaccines against pneumonia protect you against the new coronavirus? No. Vaccines against pneumonia such as pneumococcal vaccine and Haemophilus influenza type B vaccine do not provide protection against the new coronavirus. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against the 2019 coronavirus, and World Health Organization is supporting their efforts. Although these vaccines are not effective against 2019 coronavirus, vaccination against respiratory illnesses is highly recommended to protect your health. Can regular rinsing your nose with saline help prevent infection with the new coronavirus? No. There is no evidence that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. Can eating garlic help prevent infection with the new coronavirus? Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. Does putting on sesame oil block the new coronavirus from entering the body? No. Sesame oil does not kill the new coronavirus. There are some chemical disinfections that can kill the 2019 coronavirus on surfaces. These include bleach/chlorine-based disinfectants, either solvents, 75% ethanol, peracetic acid, and chloroform. However, they have little or no impact on the virus. if you put them on the skin or under your nose. It can even be dangerous to put these chemicals on your skin. Does the new coronavirus affect older people, or are younger people also susceptible? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. The World Health Organization advises people of all ages to take steps to protect themselves from the virus, for example, by following good hand hygiene and good respiratory hygiene. Are antibiotics effective in preventing and treating the new coronavirus? No, antibodies do not work against viruses, only bacteria. The new coronavirus is a virus, and therefore antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the 2019 coronavirus, you may receive antibiotics because bacterial co-infection is possible. Are there any specific medicines to prevent or treat the new coronavirus? To date, there is no specific medicine recommended to prevent or treat the new coronaviruses. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illnesses should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. World Health Organization is helping to accelerate research and development effort with a range of partners. So there we are, people. Please follow these instructions and make sure you stay good, protect yourself at all times. But so far, the situation in Nigeria is under the government control, and do not be under panic at the moment. Just live a normal life and live a good hygienic life. With that, you should be safe. All right, so guys, let me know your thoughts about the coronavirus at the moment. Let me know your thoughts. All right, and if you're new to the channel, please subscribe to the channel. Like this video by clicking the like button just below the video, and please drop a comment and click the bell notification icon so that anytime I drop new videos, you can always get them. And please subscribe to the channel using the subscribe button just below this video. Take care of yourself, guys. Stay safe, protect yourselves at all time. It's your boy Obi Mark saying bye bye.